Let us see what are the factors which are involved in the drug response. So we are taking the drug and drug is showing some sort of response. So what are the various factors which are involved in order to for a drug to show the response? So here first thing, the drug which is administered, it shows some sort of responses or some predicted response. So we are taking drug and it is showing effect. So this response is most common, but sometimes in individuals it may be, we can say that it varies. The response of the drug may vary from individual to individual. At the same time, it varies from the age group also. The response may be different from time to time and from individual to individual as well. But in some individuals or occasionally or in rare cases, it may show idiosyncratic reactions. And so, the various factors which are involved in modifying the drug response are the physiological factors, pathological factors, environmental factors, genetic factors, and interaction with the drugs. Physiological factors. The physiological factors are like age, sex, pregnancy, body weight, timings, as well as food. Let us see age. So in different age groups, what are the drug responses we can see? For example, if we take newborns or neonates. So here in neonates, as the body is developing then, so the body, if we take, there will be decreased gastric acid secretion. So the babies are given vaccination, the babies are given medications for their better growth. So in that, because of that, the drug will show some sort of response. So but they will not affect, or the drug response is not affected like in the newborns, that there will be decreased gastric acid secretion, decreased liver enzymes, liver microsomal enzymes, and there will be decreased plasma protein binding also. So the ability of the drug to bind to the plasma proteins will be reduced, and even the glomerular filtration rate, so the rate with which the drugs or molecules are getting filtered in the glomerular apparatus is reduced, and even there will be immature of blood-brain barrier in the neonates. So in the neonates, the blood-brain barrier, so whatever the barrier or the protective covering which is there to the brain, that is not even developed yet to the babies. If we take children, so in children, the drugs like tetracycline. So if we take tetracycline, it is recommended that tetracycline not to take with food. So why? Because whatever the calcium which is present in the food, this tetracyclines react with the calcium, and thereby they form permanent teeth staining. So even the calcium which is present in the teeth, that may react with these tetracyclines, and that may cause staining of the teeth permanently. And the drugs like corticosteroids. So these corticosteroids show the effects like growth development. So this growth development or the growth development may alter with the age group also. So if we give in the old age people, this corticosteroids won't act by the mechanism of growth development. So these corticosteroids may act by other mechanism to show another response. And the other one is antihistaminics. So these antihistaminics show hypersensitivity reactions in these age groups. The old age people. So in old age people, how the drugs are showing the response? So the drugs are taken, and in old age people, it will decrease the liver function. So the drugs like diazepam and theophylline, they have a side effect of decreased liver function in the old age people. And the drugs like gentamicin, digoxin, penicillins, these are strictly contraindicated in the old group, because as the age increases, then the impairment or there occurs improper functioning of the organs also. So if a person reaches to 80, then the body functioning will not be that proper. So in that condition, if we give such kind of drugs, that may lead to decreased kidney functioning, or we can say kidney failure as such, and decrease the plasma protein binding. So the drugs won't have that ability to bind to the plasma protein as well, and it will increase the sensitivity to the CNS depressants. So the drugs like diazepam and morphine, if they are given, so in old age people, if they are given antidepressants, so CNS depressants are given, and if this diazepam and morphine are taken, so these morphine and CNS depressants, they react with each other, and thereby it increases the sensitivity to the CNS depression, that may cause synergistic effect. The other one is sex. So if in males, generally if we take the testosterone hormone which is present in males, that may increase the rate of biotransformation reaction of the drugs. So here the metabolic rate with which the drugs are undergoing metabolism, the rate of metabolic biotransformation reaction can be increased in males because of this enzyme, because of this hormone. And if we see in females, the drug females are taking diazepam, then that will decrease the metabolism of your drugs. So because of the hormones which are present in the female or the female body functioning, the drug metabolic rate or the drug metabolism can be decreased. And at the same time, the estrogen hormone which is present in the females, that will inhibit the enzyme called cholinesterase. So cholinesterase is an enzyme which is aiding in the metabolism of the sympathomimetic or the parasympathomimetic or sympatholytic drugs. So in such cases, this may give another drug response. So this is one of the factors which is affecting in order to show for a drug to show its response. The other one is pregnancy. So in pregnant women, they take many medications for their proper growth of the fetus. So here, because of the drugs show responses like, so then the usual cardiac output in pregnancy, the cardiac output may be increased, and the glomerular filtration rate and the elimination of the drugs can also be increased, and the volume of distribution, the drug distribution can be increased, and even the metabolic rate of the drug can also be increased. So here the ADME process, the pharmacokinetic processes are increased in pregnant women. And even the lipophilic drugs, if the woman is taking the lipophilic drugs, so the lipophilic drugs can be easily crossed through the placental barrier. So they crosses the placental barrier, and thereby they are not eliminated out of the body that easily. The other factor is temperature. So if the drugs are taken on temperature of, if temperature is there in the body and drugs are taking. So here, if we take the drugs, if we take drugs when there is mild to moderate hypothermia, so if there is any slight increase in the temperature than the normal and drugs are taken, that may decrease the systemic clearance of cytochrome metabolizing drugs. So here the cytochrome P450 is a protein which is important protein which is aiding in the metabolism of the drugs. So here the metabolic rate can be decreased when the drugs are taken if the temperature is mild to moderate, and if the temperature is high and the drugs are taken, that may lead to the decrease in the potency and efficacy of the drug. So here the increased temperature is there and drugs are taken, and then the efficacy or the drug potency can be decreased in this condition. And even the temperature will influence the therapeutic index of the drug. So therapeutic index is nothing but the region or the margin where the drug is showing its therapeutic use or its clinical use. So at this region can be narrowed because of the temperature. Here, see, for example, if a drug is showing the therapeutic effect at 650 mg, so it has to be given strictly, plus 50 or minus 50 dose can be acceptable. But if the temperature is there, even the increase in 1 mg of the dose can also lead to adverse drug reactions. And decrease in the neurological damage in patients experiencing cardiac arrest. So here, if the temperature is there and if a person is having some serious cardiovascular problems, and if he takes the drugs, then that may decrease the neurological analgesia, the pain which is caused in the CNS, the damage which is caused in the CNS can be decreased. Let us see the timings. So here we human beings, if they are, our body has a systemic rhythm. So that is called as that is called as the circadian rhythm or circadian cycle. So here at this time, so our working timings are from morning 7 to evening 8. Let us imagine. We have to work at this time and we have to sleep at 9 and too early in the morning 5 o'clock. That is a sleeping timing. So this is the circadian rhythm. We have to work in this particular time and we have to take rest at this particular time. And if there is any changes in the circadian rhythms or if there is any changes, so for example, if we take few people have night shifts during their job. So during that time of sleeping they are working, and during the time of working they are sleeping. So the circadian rhythm is completely reversed. So in this condition the drug response will be altered. For example, if we take coronary heart disease, so if a person is having coronary heart disease and his circadian cycle is improper, then it leads to adverse drug response. So here we can see the circadian cycle. Here in the midnight we have to sleep, and at 2 o'clock there will be deep sleep, and 4:30 there will be slight body temperature, and morning at 6:45 there will be rise in the blood pressure, and there will be 8:30 will have bowel movements, and at 9 o'clock there will be highest testosterone secretion. So all these are the circadian rhythms. See, body has some particular time. At this time this function has to be done in the body. So this is called circadian rhythm. If we follow or not, body does its own function. So if there is any changes in the circadian rhythm, the response shown by the drug will be altered. The food. So how does the food is affecting on the drug response? So if the fatty foods are present in the stomach, so if we are taking the junk foods or roadside foods or fatty foods, high cholesterol foods, then the gastric emptying time is increased. So in the sense, the time which is required for the contents of the stomach to get out of the body, out of this stomach region, then that will be delayed because of the fatty food present, because the fatty foods cannot be easily digestible. That is the reason they stay in the stomach for longer period of time. And the plasma concentration of rifampicin and ampicillin like drugs can be reduced if they take on full stomach. So after taking food, we have to give a gap of 1 to 2 hours we have to give a gap of 1 to 2 hours in order for the drugs like rifampicin and ampicillin to take. Otherwise, if we take these drugs on full stomach, then they won't reach the plasma, or then they won't reach the systemic circulation. In the sense, the availability of the drug in the blood will be reduced. And the calcium. So the calcium which is present in the milk, it interacts, or the calcium which is present in the diets, it will interact with the drug called as tetracycline, leading to the permanent staining of the teeth. And the proteins, fats and carbohydrates which are present in the food, then that increases the drug oxidation level. So the drug will get oxidized more if the protein, carbohydrates and fats are present in the diet. The foods like grilled beef, charcoal, cabbage and alcohol. So all these dietary supplements or all these foods which we intake, that will increase the metabolic rate. So here the metabolic rate will be increased, and thereby the person feels more hunger. And protein malnutrition affects pharmacokinetics of several drugs. So if the proteins are not sufficiently taken, or if there is any deficiency in taking the proteins, then that may lead to, or else that may affect the pharmacokinetics of drugs. In the sense, if proteins are not present, then the absorption, distribution and metabolism and rate of elimination of the drug can be decreased or increased to some extent. And the drugs or the food supplements like citrus flavonoids which are present in the grapefruits, not in the orange fruits. Even in the orange we have citrus flavonoids, but especially the citrus flavonoids which are present in the grapefruits only will increase the absorption of drugs like cyclosporin, calcium antagonist and other drugs. Now let us see the pathological changes. So what are the pathological changes which are affecting in the drug response? So here the disease causes individual variations in the drug response. So here the disease, if we are having any disease, then that disease is also affecting the drug response. For example, if we take the drugs like warfarin and tolbutamide, so these drugs, if there is any decreased plasma binding is there for these drugs, then that will lead to severe adverse drug reactions. And even if there is any decreased hepatic blood flow, so in the hepatic region or to the liver, if the blood supply is not proper, or if the blood supply is decreased, then that will decrease the clearance of morphine and propranolol. So here, if there is any improper blood flow to the liver, then the clearance of the morphine and propranolol like drugs will be decreased. If they are not cleared out of the body, then that may lead to severe drug effects. And impaired liver microsomal enzymes. So here the microsomal enzymes which are present in the liver, which are aiding in the metabolic reactions, can be impaired or they cannot be improper. And the drugs like because of the impaired liver macrosomal enzymes, so because of the decreased macrosomal enzymes, then there will be the decreased metabolic rate of diazepam, rifampicin and theophylline like drugs. So these drugs will not be metabolized properly if they are having decreased liver enzymes. Now, let us see how these pathological, for example, in the renal disease. So, what are the drug responses we can see? So, there will be decreased glomerular filtration rate and decreased tubular function. So, the functioning which is occurring in the tubule of the nephron will be decreased, and there will be decreased plasma albumin. So, it is a plasma protein which is present in the blood, and that will be decreased, and there will be decreased excretion. So, the elimination rate of the drugs like digoxin, lithium, gentamicin and penicillin will be decreased in the renal diseased condition. And in malnutrition, so if there is any deficiency of nutrients and there occurs malnutrition, then the responses which are shown by the drug are decreased plasma protein binding of the drug. There will be, the drugs won't be that able to bind to the plasma proteins, and even there will be decreased amount of microsomal enzymes. Then if the decreased amount of microsomal enzymes are there, then drug metabolism will be decreased, and increased portion of free unbound drug. So if the drug is not binding to the plasma protein, then the drug stays unbound state or in the free state. So if the drug is staying in the free state, then if the drug is staying in the blood for longer period of time, it shows the effect. But apart from that, it even shows the side effect also. For example, warfarin. So let us see what are the pharmacokinetic variations. So how the pharmacokinetics of the drug are altered, or what are the pharmacokinetic variations we can see. So pharmacokinetics involves absorption, distribution, metabolism and elimination. So here absorption. So if we take the gastric as well as intestinal stasis during the migraine interferes with the absorption of the drug. So here if a person is having migraine, and if he is taking medication against the migraine, then that will interfere with the absorption of the drug, because in migraine, if a person is having the gastric and intestinal pH or the environment in the gastric and intestine is not maintained, then in that condition the drug absorption will be interfered. And resection of the gut. So here if there is any resection or removal of any part of the intestine like ileum or stomach region, or if there is any resection of this part of the intestinal region, then the absorption of the compounds like iron, folic acid will be reduced. So here in the intestine only the nutrients or vitamins like vitamin B12, folic acid as well as the iron are getting absorbed. So if the part of intestine is removed like ileum, then the absorption won't take place. So if the absorption is not taking place, then that may lead to deficiency of the nutrients, leading to the malnutrition. Let us see how the metabolism is affected. So here the acute and chronic liver diseases. So if there is any disease to the liver, or if there is any necrosis to the liver, then the metabolism won't occur. So because most of the metabolic reactions occur in the liver itself, and if the liver is impaired, then the metabolic rate will be decreased, and drug metabolism is increased. So in the increased, for example, if we take thyroid hyperthyroidism and in hypothyroidism, if the thyroid hormone is diminished in hypothyroidism. So here in the hyperthyroidic disorders, we can say in simpler ways, if in the thyroidic disorders, the metabolic rate can be increased or the liver functioning can be increased. And here if we see in the excretion, how the drugs are affected, how the response of the drug is affected, here in acute and chronic renal impairment, the concentration of the drug is altered. So here if there is any impairment if there is any impairment or improper functioning in the body, then the rate of elimination, the rate with which the drug has to be eliminated will be decreased, or sometimes it may be increased. In the sense, the drug without showing this therapeutic effect only, it will be eliminated out of the body. The other thing is pharmacodynamic effects. So what are the pharmacodynamic effects which are altering the drug response? Pharmacodynamics in the sense, what are the biological alterations which are going on in the body? For example, if we take asthma. So here the beta blocking drugs, especially the drug called salbutamol. So that salbutamol is a beta blocking agent. This should be strictly contraindicated in asthma, because patient is having asthma and he is taking salbutamol or beta blocking agent. Then beta blocking agents have a special characteristic feature of bronchoconstriction. They will constrict the bronchi. So here in asthma, if bronchi is constricted, then that may lead to the or else it may cause the severe, or else the drug synergistic action can be produced. And the intraocular pressure, the intracranial pressure, so the pressure inside the cranial region can be increased because of the intolerance which is provided by the drugs called opioids. So here in the opioids, we are taking opioids and these drugs show intolerance. So because of the intolerance which is caused by these drugs, then that may lead to increased intraocular pressure and severe pulmonary insufficiency, because in the sense the oxygen supply to the pulmonary region is not proper, or the blood supply in the pulmonary artery or vein is not proper. And in the myasthenia gravis, so in myasthenia, if a person is having myasthenia gravis and he's taking the drugs like quinine, quinidine and aminoglycoside, so these drugs can change the receptor action. So the receptor action can be altered with these drugs in this condition. And in the there will be, in hyperthyroidism condition, the adrenaline will have more sensitivity towards the adrenergic receptors. In the sense, in hyperthyroidism, the adrenaline in this condition, if we are giving adrenomimetic drugs or sympathomimetic drugs, then it has the greater affinity towards the a greater affinity of adrenaline towards the adrenergic receptors, and that may lead to the synergistic effect again. Now let us see what are the genetic factors. So what are the genetic factors which are involved here? So existence in a population of 2 or more phenotypes with respect to the effect of drug. So here these type of the factors, in the sense they are hereditary, they are carried from their ancestral origin. For example, the acetylation of enzymes deficiency, acetylation enzyme deficiency takes place. For example, if we take the glucose 6-phosphate dehydrogenase enzyme, so this enzyme is deficient by birth to that person because it is a hereditary, it is carried from their ancestors. So such type of enzymes, the acetylation enzymes will be deficiency. Because of that, the metabolic rate of the drug can be altered. For example, if we take the drugs like, we can see SHIP in the sense the drugs like sulfonamides, hydralazine, isoniazid, as well as propanamide. So these type of drugs, they get metabolized by the acetylation process itself. So the metabolism of these drugs has to be done, because if the metabolism is not occurred, then these drugs show adverse drug reactions. So here they occur by the process of acetylation. But if acetylation causing acetylating metabolizing enzymes are not present by hereditary, then the acetylation of these drugs won't be there, and thereby that may lead to severe adverse drug reactions. Even the rapid acetylator phenotype can decrease the effect of the drug. So in few people, if the acetylation enzymes are in over, or if the acetylation enzyme rate is more, then that may lead to the metabolic, the drugs won't show its therapeutic effect, and before that only they get metabolized. The other one is pseudocholinesterase deficiency. Now let us see what are the examples of genetic factors. So pseudocholinesterase deficiency. So here succinylcholine is a drug, or it is a neuromuscular blocking agent which is metabolized by the enzyme called as cholinesterase. And if there is any deficiency, deficiency of this cholinesterase enzyme, that may lead to the more amount of succinylcholine in the blood, and thereby it leads to the succinylcholine poisoning. Malignant hyperthermia. So here, because of the succinyl concentration, here the example is again succinylcholine. So here the succinylcholine is not metabolized and succinyl poisoning takes place. It leads to the over increase in the temperature in the body, and because of the over increase in the temperature, that may lead to inability to chelate calcium. So here the calcium will not bind to the or else the calcium will not bind. Chelation in the sense binding of the ligand. So here the calcium won't be binding, and thereby the metabolic metabolic or the muscle tone can be altered. So the calcium by the sarcoplasmic reticulum. So calcium will not bind to the sarcoplasmic reticulum, and thereby the muscle tone will be improper. Because of that, the excessive calcium release is occurring in the body, and because of the excessive calcium which is released, then the muscle spasm occurs. The muscle will be in the contracted state for longer period of time, because here the calcium is not binding, and if the calcium is not binding, the intracellular calcium level will be increased, and if the intracellular calcium level is increased, it causes depolarization of the cell, leading to the contraction of the muscle for longer period of time. Because of the increased contraction, then that leads to the increased temperature. The other one is glucose deficiency of the glucose 6 dehydrogenase enzyme, glucose 6 phosphate dehydrogenase enzyme. So here, if the glucose 6 phosphate dehydrogenase enzyme is in deficiency, then that leads to the hemolysis of the RBC. For example, if a person is having deficiency of this enzyme and if he takes primaquine drug, and then that leads to the adverse drug reaction called as hemolysis of the RBC. And even the sulfonamides, the long-acting sulfonamides also can cause the hemolysis of RBC in this condition. Let us see the environmental factors. So what are the environmental factors? For example, the microsomal enzyme inducers. So here if a person is having the habit of taking tobacco, or if a person smokes, then because of the smoking, the metabolizing drugs more rapidly than the non-smoker. So here in the smokers, the metabolic rate will be more than the non-smokers. So here thereby the enzyme, metabolic enzyme, these are called as metabolic enzyme inducers. So if we take smoking person and non-smoking person, when compared to non-smoking person, smoking person will have increased metabolic rate, but that increased metabolism is also not that good for the body. The other one is tolerance. So here within some drugs, the intensity of the response. Here if we see, we are giving some sort of dose for a medication, some sort of dose of a drug in a medication. So if the drug is used for chronic period of time, then the body shows tolerance. The drug will be accepted by the body. So because of that dose, or else we are giving 50 mg. For example, we are giving 50 mg of the drug in order to cure a disease, and we have used this 50 mg for about 2 to 3 months. And after 2 to 3 months, this dose of drug is not showing effect on the body. In the sense, the body got tolerated to the drug. That is the reason that the dose of the drug should be increased. So if the dose of the drug is increased only, then the drug response will be altered. So in this way, the tolerance also affects the increase in the drugs. For example, if we take drugs like salbutamol, opium, opioid analogs, and barbiturates and alcohol. So all these show the effect, or else we can say all these show the tolerance in the body. The other one is tachyphylaxis. So tachyphylaxis is nothing but it is in the sense when a drug is administered, the response which is showed by the drug is completely abolished. So the drug, if the drug is administered and if we are taking the drug, whatever the action which is shown by the drug, that will be completely removed, or the drug will not show effect at all in the process. If in the tachyphylaxis condition. So in the tachyphylaxis condition, it will not show any effect. For example, if we take the drugs like ephedrine and amphetamine, if a person is having tachyphylaxis, and then this drug will not show any effect in the body. The other one is anaphylaxis. So anaphylaxis is a serious adverse drug reaction, or it is a serious allergic reaction. So here this is a specific antigen leading to life-threatening respiratory distress. So if a person is having anaphylaxis, then the drug response will be altered, and thereby it may cause severe adverse reaction. Sometimes it may lead to death of the person also. So here in these conditions also the drug response will be altered. The other one is idiosyncrasy. Idiosyncrasy is nothing but the genetic abnormality. So because of the genetic abnormality, if there is any abnormal functioning in the liver, or if there is any deficiency of any enzyme, or if there is any abnormality in the receptor action, then that leads to the various drug responses or various drug reactions. So this process is called as idiosyncrasy. So the example is again the aplastic anemia, which is shown by the drug called chloramphenicol in the deficiency of the glucose 6-phosphate dehydrogenase. So if a person is having glucose 6-phosphate dehydrogenase enzyme deficiency, and if he takes chloramphenicol, then that leads to the aplastic anemia. And even if a person is having, if a person is taking the carbamazepine, so in hepatic porphyria can be occurred if a person is taking the carbamazepine drug. And the suxamethonium, even the suxamethonium poisoning occurs, and thereby that leads to the malignant hypothermia. So all these are like genetic, so they are genetically transferred from their ancestors.